We're 2 minutes behind, but we're doing just fine. Thank you, Rob.
All right. Good morning, everyone. So some of the concerns with transportation, obviously, is load capacity. We have buses that can seat up to 77 students. Some of our elementary runs will have up to 70, sometimes 70 plus students on a school bus. The CDC recommends, when possible, one child per seat, then separation, then another child in a different row, which gives us about 13 students per bus, which is, there's just no way that we can do that. So in the phase 2 of reopening, says that no more than 50 people can gather in a group. So we're looking at that load capacity. If we go back to brick and mortar 5 days a week and can only put 49 or 48 students on a bus because of a driver for 49 and a bus attendant and driver for 48 students, we'll still need 137 more buses than what we're currently running for our elementary, just our elementary runs today, or before we went on this break. So we then have to figure out how are we going to disinfect the bus in between runs. Are we going to do it before we start our day, and then after we end our morning runs, and then again before we start our afternoon runs, and at the end of our PM runs? Or do we do it in between runs? So if we have a high school run, we stop, disinfect, load elementary run, stop, disinfect, then load a middle school run, and once that's over, that's their end of their run. Some may have trips in between, so they'd have to disinfect. That's time. The product we're using has to have contact for at least 10 minutes, and then it has to be wiped off or it has to dissipate. So we're looking at some other products that will speed that process up, but it's going to be difficult for us to clean between the runs and then load capacity. So those are our main concerns in transportation. If we go back to school 5 days a week and we have anywhere of the load, the capacity that we have been transporting, like we transport 18,098 students in the October count. We probably transported similar to that just in elementary. We transported about 46,000 between all three tiers, and the load capacity is our biggest concern, and then the disinfecting in between routes. So, any questions?
Rob, this is Larry. I've had a few calls from a few bus drivers, and they're concerned about the capacity of the bus and loading it and all. And I'm not really concerned because I know the district's going to work something out to make it safe for all employees. But have we looked at staggering schedules at schools or anything to help change that capacity on the bus? Maybe schools going to different schedules, like 2 elementaries not opening up at the same time and stuff like that.
We are looking internally at different options. When we first started talking before Governor Santos came out with the reopening of school year 2021, we felt like if we had students go a Monday, Wednesday, and a Tuesday, Thursday, with a Friday as a deep clean, we were going to be able to meet the capacity and the current bell schedule. But if we go back 5 days, we know we don't know the number of people that are going to go virtual. That's unknown. We can put a survey out. Manatee County did this. We can put a survey out asking parents if they're planning to use the school bus as a option for transportation. And the only concern I have with that is you can do a survey. You may get 41% back, or let's say on a good survey, 50% back. But if that child is eligible for transportation based on state statutes and state board rule, it doesn't matter if they fill the survey out or not. If they're at the bus stop and they are eligible, we're going to have to transport the child in. We're doing things for our employees. We have hand sanitizer for the students. As soon as they embark the school bus, there is a hand sanitizer. It's alcohol-based. The state gave us a waiver to put alcohol-based products on school buses. Before we could not. So they would basically, it's a foam base, just like what's in the schools and what's in our buildings now. So they would use that, loading and unloading the school bus. Our drivers will be giving, they'll be giving thermometers to take their own temperature, because we don't compound school buses. They'll take their temperature, record it, and then log that in with their area manager. And then, of course, we are providing masks and gloves and all of the cleaning equipment they would need.
So Rob, this is Joy Jackson with the Health Department. Can
Yes,
you hear me? So I just want to weigh in on the fact that one of my biggest concerns is with school buses for several reasons. It's a closed environment. Students will be close to one another. They'll be on there for a period of time. And I think the things that you've outlined, with as much distancing as possible and with regular cleaning, we have to really enforce those things. Some other things I want to throw out are number one, and this would not be desirable for the students, but having the windows down.
Yes, ma'am.
Raising the possibility of students on the bus being required to wear masks. And then number three, assuring that our bus drivers are as safe as possible. So having a firm plan for them to wear masks and gloves, no hugs, no close interaction. And I'm concerned about our bus drivers as well.
Yes, ma'am. I appreciate that, and we are as well.
Dr. Jackson, this is Linda King. Rob, one thing I saw, I looked at Leon's plan, and very similar, Dr. Jackson, to what you're talking about. They were asking the students to wear masks. The drivers were also equipped with masks and gloves, and disinfecting, and yes, opening windows, even if it's just between runs, so to speak, to kind of air out. In addition to, of course, depending if it's raining, it's hot, we may not be able to open them all the time, but opening as much as possible to allow that natural ventilation. But those were things that one of the, it's Leon County, so it's way up north Florida, but that was exactly what they were proposing for their students.
And I personally believe also, thank you for that, I also believe that parents whose kids ride a bus need to be aware that that is, whether you call it, we need people to wordsmith it, extra risky, because that may weigh into their decision about whether that child will be on the bus. But that is such a serious thing to be on the bus with that many people that our parents need to be informed of the risks, and they can decide if they choose to take the risk.
So
Dr. Jackson, I agree with it. Go ahead, Rob. I'll wait.
No, I weigh in on. We have a procedure that we're setting up for summer school, because we'll be transporting. That's in the that is in the grant to get summer school up and running. That we would provide transportation and school nutrition. So we are developing a cleaning procedure. We will have masks for students. We will ask the parents to provide them, but if they don't have them, we've got masks that the state has sent us. We have another group from the EOC that should be arriving any time now. So our employees, our students, we're going to do everything possible, and then communicate that before July 8th to the parents. And again, our look at it is we would try to get as much distancing as possible, but we would not put any more than 49 students on a school bus, and that's still 2 to a seat, basically, for every bus we run.
Yeah, are we going to try to communicate with the parents that wherever possible that they bring their kids to school instead of coming in on the bus, even if they were traditionally riding the bus?
We can work with our PR department to come up with some type of communication that gives them the information on this, on the concerns of the school bus that Ms. Jackson has stated, and Ms. King has stated that this is a higher risk when you put them with 50 bodies on a bus for a long period of time, or even a short period of time, 30 minutes or more. It's concerning.
Yeah, because I believe some parents would that traditionally doesn't bring their children to school, that if we communicated with them, that maybe we can, a few of them, I know everybody can. That's why we have busing, because everybody cannot bring their kids to school. They either work or they have other reasons why they have to utilize our buses. But the ones that don't, if we can try to communicate to everybody, maybe if we get a third or even a quarter of our kids who are able to be brought to school that traditionally rode buses, that would cut back on the capacity in our buses.
So, one thing that
Rob, this is Linda. What's the plan for the bus attendants that are caring for our special needs, special needs students? I mean, I would say at a minimum mask and gloves, and the issue with them obviously is they are required to tend to or care for the student in some way, form, or fashion according to the IEP. I just didn't know what else we could do, or Dr. Jackson, if you had some suggestions.
Yes, ma'am. I don't know if Audrey Kelly is on. We actually had a conversation a couple of days ago about caregivers in the classroom and what kind of personal protective equipment they should wear. And I'm assuming these bus attendants, do they go into the classroom with students, or are they strictly bus attendants?
Basically bus attendants.
Okay. I really feel strongly if you've got students that have a trach or that need any sort of care around their head and neck with respirations, need to, if possible, wear N95 masks. At the least, a surgical mask, not a cloth mask. They need to wear a face shield or goggles, and they need to wear gloves.
So, Dr. Jackson, we were looking at face shields and gloves. The goggles is a good point for our bus attendants that are dealing with our students with special needs.
Now, either will provide eye protection, but my teams that have been out doing outreaches say that the face shields are very hot, particularly on top of a mask, and that the goggles are, they're less hot. They tend to steam up. So, my staff tend to prefer the goggles, but that doesn't protect the skin. So when they remove things, they need to be careful not to then rub their nose or their eyes.
Yes.
So there's some training that will need to be undertaken for anyone wearing that level of really healthcare provider protection.
Rob, if I may jump in.
Yes, sir.
Dr. Jackson and Linda, thank you so much for your input. That's exactly what we need to start zeroing in on those extremely important details. Jenny Siren, she's got a question here. Let me see, I'm getting a little feedback. See if I can turn this down a notch. You hear me okay? Are there any protocols being talked about for students getting on the bus And we talked about, Rob, I know you talked about hand sanitizer being available, temperature checks. That's a question. So here's a concern when it comes to enforcement, and I really appreciate Dr. Jackson mentioning that if we're in order to make this as safe as possible on a bus, we're going to have some mandated protocols, basically. Now, here's a concern for just a practical concern. Child comes to the bus stop, doesn't have a parent there, is at the bus stop, and doesn't have a mask. Obviously, we can provide additional masks for those situations. So that potentially could resolve that way. Temperature checks. Let's say we did do temperature checks where they boarded and they had a temperature. What then? Because you can't leave a child at a bus stop, drive off, and leave them unattended. So these are just real situations that occur that obviously we want to have answers for.
Mr. Hill, if I may, you talked about the temperature checks. However, on April 10th, CDC sent out notification that children are not experiencing symptoms the way that adults are. And the CDC point blank says that temperatures do not necessarily show up in kids who have the COVID virus. So us putting time and effort into taking temperatures for something that the CDC says isn't working anyway, why are we going to invest all of that time and effort into something that the CDC says don't even bother?
And as Mr. Hill stated, if we did take a temperature and there was a temperature on a child, we're not going to leave them at a bus stop without parents there. And we have a high population that elementary students through high school that parents aren't at the bus stops. And one thing I wanted to come back to what Larry said is, having students that normally would ride a bus decide not to ride the bus. We've actually asked for a waiver because funding is by the number of students that you transport. So a higher average bus occupancy for transportation, which we're around 84, is good when you don't have COVID-19. When you have COVID-19, it truly impacts a efficient district. And so our peers with the Florida Association of Pupil Transportation, our president and our finance association has asked for a waiver to count the students that were transported this school year to be followed over for next school year, because we don't know what will be the case. And that's the funding that we receive for operation.
Rob, you currently have a problem, not a huge problem, but it is a problem of getting staffing as it is for our school buses. So what is going to be put in place for your bus drivers who already are at high risk and therefore cannot perform their job? And if we come up with a situation that we have an infection on a bus, and so now a bus driver is quarantined for 2 weeks, how is that bus route going to be able to be covered when you already have a shortage?
Yeah, that's a great question. We've lost drivers from this break. They've sought other employment. Other people have reached out to. So we're battling that now, trying to get people trained, ready to go. But if we have a student or a driver that tests positive on a school bus, we're going to call that a sick bus. We can disinfect that bus with a product called Clorox 360. It's a machine that can come in and spray the entire bus down. And then that bus, in a matter of 30 minutes, is disinfected. But we don't have a driver behind the wheel. So those are things we're trying to deal internally and trying to get drivers enticed to come to work. under these conditions, and it's a huge obstacle that we're facing right now.
Yeah, Rob, I just wanted to say, where you hit on that point about drivers finding other jobs, I have got that message from a few of our drivers. And the reason was because they rather be in an area where they're not in contact with so many people like they would be on the bus. And that's some of the reason why they are seeking other employment than coming back to drive for us.
And we have, I think, 85 over 65-year-old drivers. That is another impact that will not only hit us, but also school nutrition, which is another area that is of concern with box lunches and cafeteria feeding. It's a another concern we're having, and we have a high number of over 65 employees in that area as well.
Rob, in the cafeterias, we can actually feed in classrooms, can't we? Instead of gathering in the classroom, taking food to the classroom instead of gathering in the cafeteria itself.
No, sir, you'd have to have that negotiated through PEA because that is a violation of our contract.
Yeah.
Exactly. And that has been some of the conversations we've had at first. If you do a grab and go, it says box lunches, but we're going to say a grab and go where they would go back to a classroom, then that's going to have to be negotiated with PEA. So let's say 50% do that on Monday, and the other 50% stay in the cafeteria, do social distancing. In between runs, drivers and attendants can come in and help schools with that. That would probably need to be negotiated as well, Larry. And then we're providing a hot meal for a student. Right now, everything is cold. And so we want to try to, if we go back to a 5-day schedule, that we at least provide warm meals or hot meal, to the students a portion of that week.
Because I see if we're not taking anything to a classroom, if that negotiation isn't done with PA or something, then I see us stretching out the lunch hours, the lunchtime, instead of it starting at say 10 o'clock at the school and going to 1, maybe it's going to start at 9:30 and go to 2 or something. I'd put less people in there. And that's going to disrupt the schedule in the school itself.
Right. If I could jump in, Shane, we appreciate your input, and Larry and Rob. One of the things that we know and appreciate the work we're doing with our teams is a number of these items, as Shane indicated, and you indicated with Larry that we're going to have to work together collaboratively and negotiate some of those unique situations and work together on those. Jeannie is waiting to get in the mix. So Jeannie, if you'll unmute.
Okay, so I guess my question, we were just talking about the buses, like what happens if a driver comes down with COVID and then they have to be quarantined for 14 days. The same goes like for a classroom. So like, would the whole class be quarantined then for that 14 days? Would the school need to be quarantined and cleaned? Or do we have any of those? Have we talked about any of those protocols yet of what we're going to put in place? And the same goes for the bus. Like, would that whole bus, would they be off of school for those 14 days because they were on the bus and were exposed? Or what are we kind of talking about putting in place there?
Can I speak to that? This is Joy Jackson from the Health Department again. Because I also want to back up. I'm on my other screen looking through the CDC guidance about temperature checks. So I'm going to roll that back, for buses. I'm going to roll that back in as well. Just to let you all know, if somebody on a bus or in a classroom ends up testing positive for COVID, then my contact tracers will do a case investigation and will identify those that were in close contact to them for 2 days before symptom onset. Those people will be asked to exclude. This pertains to work sites, it pertains to healthcare facilities, it will pertain to schools. So if a school bus driver or a student on a bus rides the bus on a Monday morning and Monday afternoon they come down with a fever and they go and get tested and they're COVID positive, then we will recommend that everybody that was on that bus or in that classroom go home and self-isolate for 14 days. So there's a huge potential impact. So if I could back up to the talk about temperatures, and Mr. Olson is absolutely right. We cannot take any one sign or symptom or physical finding as the absolute fact of truth, because even people with robust COVID can have fluctuating temperatures. Some people never have a fever, some people spike 104, and it has to be taken in context of other symptoms. So I'm going to put a scenario out. What if a child shows up at the school and is screened as they get off the bus and they have a fever of 102 and it is COVID? We've just exposed that whole bus. If we had screened them before they get on the bus, then we might have prevented that significant exposure on the bus. So I would advocate, if we're going to do temperature checks on kids on buses, do it when they're getting on. I would also advocate, and I'm going to see how many heads nod about this, I think an adult should accompany all children as they go to the bus stop, whether it's a parent or a designee. That way, if somebody screens either by symptoms or by temperature, they can go back with that person. I would suggest you consider that. And that has the parent being involved in this decision regarding their child.
And I understand that completely, Father Jackson. And but I stated earlier, the concern is a lot of parents, both parents work. They'll send their child to a bus stop, and we see it every day when we have kindergarten students that get off a bus alone, and or with a sibling that's in third grade and walk home together. It's to mandate that. Can we do that is one thing that we probably need to check with legal to say, can we mandate a parent be at the bus stop? A temperature check has to be taken before they get on the bus, and if there is some type of temperature, the parent takes the child with them. Is that something that we can mandate? And if so, then I think that's a route that we have to take.
Linda, are you talking? You're not on if you're trying to weigh in. There you go. Go ahead, Linda.
You're still muted, Linda. There you go.
You have access,
My
Linda.
mouse has a delay. I apologize. One thought I had on that, Rob, is it a way, because I like Dr. Jackson's suggestions, because you're talking about affecting up to, 49 children, 49 families, if we do have a positive. Is there a way we could have parents re-register for busing this year? Now, just kind of hear me out and say, we'd really like you to appoint a family member. If it's not going to be you or one of your family members in your household, appoint a community member or somebody that's going to be in charge of your child or walking your child to the bus stop that morning. And we're talking obviously the elementary age group, and I'm not sure, usually middle school, they can go back and forth to the bus stop depending on what age. But that was just a thought this year, just because we're in such a different time, and maybe we can do that through some sort of automation or through the schools themselves. I'm not sure how they're registering right now for transportation, but perhaps we can do some sort of re-registration to help us accomplish that. And maybe we need a survey ahead of that to see whether or not it's even going to be feasible.
We have discussed a survey. We have the main question is, can we mandate that to happen? Can we enforce that to say a community member or a parent has to be at the bus stop for their child, or they take responsibility for a group of students. Can we do that and mandate it and stick to that?
So these are the type of barriers and challenges we are tasked with overcoming and figuring out a solution to. Not only is that going to present a barrier for children on the bus, but and I know, Rob, and those of you that are school-based personnel know that there are times when we have sick children at school and cannot get anyone to pick them up or make contacts. And so one of the things that I think we're all aware of is that our most fragile students and families are the ones that are going to be, unfortunately, they're going to be greatly impacted by this because it does present challenges. And so I think one of the things we'll do today is after we, with these suggestions, Rob, we'll get those in front of legal and have some discussions, because much of the things that we've heard and talked about, not only in this meeting, but other meetings, it really, once we establish a protocol or a process or a best practice, it's going to come down to enforcement as well, and having a systematic way to enforce. So it's going to add time to bus runs. Jenny in the chat, brought that to our attention as well. It's a domino effect of things. So greatly appreciate those solutions. So let me get clarification, because Shane had mentioned the CDC about the temperature checks. There's been talks about temperature checks when students come to school, temperature checks on the bus. And just for clarity, as Dr. Jackson had said, there's so many variations in the symptoms, but we do know for sure if they did have a high fever, that would be one definitive way. If I understood correctly, that would be one way that we could definitively say, no, this child needs to not get on the bus, or this bus driver needs to be home, or, so I guess clarity on which practices give us the best opportunities to provide as much safety as possible. Dr. Jackson, if you can kind of reiterate that for me.
You're muted, Dr. Jackson.
There you go.
Yeah, sorry. And you're asking and bringing up some very important points, because unfortunately, in certain populations, 30 to 40% of people with COVID are asymptomatic. Mm-hmm. And what percentage of children with COVID are asymptomatic? I don't have it specific to that age group. So all we can do is the best we can do, which is to screen for symptoms, and screen for temperature. We contact trace, and frankly, in young people, most times they're exposed through family members and family events. We're finding this in Polk County. So all we can do are those things, and the other hygiene and environmental cleaning that we can do. So the question is not going to be, can we prevent COVID from being on a bus or in a school? We'll do the best we can, but we will probably be fighting a battle every single day. We're going to be dealing with this every single day. And COVID in Polk is increasing. I'm not going to hang the crate, but the numbers are not looking good for the state and the county. So all we can do is the best we can do and follow the guidelines.
Thank you.
Mr. Hill, I do know that I'm the representative with PEA. That's why I keep bringing up PEA in case you aren't aware. And Steffi and I had a long chat, and the instructional team is going to be looking at 3 potential ways of reopening school. And I think looking at those 3 ways will have an impact both on the buses and every other way that we're looking at. And the 3 ways that they're looking at reopening is 1, a full virtual reopening, 2, a hybrid reopening where students will be tied to their schools so that if they want to participate in sports and such, that way they don't have to be limited if they went strictly to Florida virtual, or 3, a full reopening. And from what I'm hearing with the discussion with Rob right now, is that these are things we're looking at with a full reopening. Whereas if this team, with Dr. Jackson's words resounding in my mind, state that we do not feel that a full reopening is in our best interest, but to go to one of the other two of either a virtual reopening or a reopening that is limited, it would help Rob with the bus situation. It would help the classroom teachers in the fact that we're going to be trying to figure out how are we going to social distance 25 kids in a room that's designed to hold 15. And that's just a reality that we have in Polk County. I teach in those classrooms myself, so I know that there's no way we are going to have 6 feet between 22 kids in some of these classrooms. We also need to look at a reality of face masks. We seem to have in our society right now a misunderstanding of what face masks are designed for. People think that if you wear a face mask, you're protecting yourself, whereas the face mask is being designed to protect other people if you have it yourself, passing it on. But we need to, as a committee, come to a stand and say, we are going to insist and make it policy that you have to wear face masks unless there is a medical reason that you should not be able to, and only Dr. Jackson would be able to answer that.
Shane, thank you. Points well taken. And yes, I'm aware that you are a representative for us, and we appreciate your input very much. Thank you. Dr. Jackson, did you want to piggyback on that?
Yes, sir. Now, I do have to tell you, as your local public health official, I am not to put myself into policy decisions. I'm here to provide information about the state of COVID in the county. I'm here to shine attention to CDC guidelines, and I'm here to provide support for whatever decision the school board makes. I do have some recommendations, but I cannot weigh in on whether there should be a full limited or no opening. That's completely a school board decision.
Right. Thank you.
Thank you.
Okay, Mr. Hill,
yes.
can I say something?
Absolutely.
If we go to a full virtual reopening, I just am concerned what's going to happen to my bus drivers and attendants, because if we're not transporting children, and we have trouble hiring them type of people anyway. And if we go to a full virtual opening and then people are not working, finding other jobs, and Rob can attest to this, we have trouble hiring these people. And if we start losing them in droves on account of this, it's really going to be, if we ever do get to a full reopening, we're not going to be able to full reopen it. It's going to stay virtual because we won't be able to transport them.
Right. So obviously that presents some challenges, I think. And I stated this again in the information I sent out yesterday. And I think to Shane's point, when we're looking at the two broad areas that the governor has given guidance on in the Florida Department of Education, we know that within those two, the full opening, brick and mortar, and then increasing our footprint for the virtual opportunities, virtual learning with Polk Virtual. Within those guidelines, we are definitely going to have to find ways to be creative. Just one of the point of discussions we had today, if there is an exposure that impacts students, teachers, bus drivers, and per the guidelines that Dr. Jackson indicated, then you could receive a call as a building principal that said, you've got X number of teachers, potential cafeteria managers. There could be a domino effect based on the contact or the level of exposure, and then now you're trying to mitigate that. You got to have staff and personnel, and you have to have a plan, an action plan to be able to sustain that. So some kind of flexibility is going to have to be created, some contingency plans built in for that. So it'll be interesting, and Shane, you referred to this, it'll be interesting to see what the learning, the teaching and learning, the group that's focused on the instructional side of the equation come up with in their discussions once we bring these back together and analyze the issues and the barriers and begin to find ways to mitigate them. So, you know, ultimately, we're going to have to come up with plans and policies and ways to negotiate and to effectively negotiate whatever reopening actually ends up looking like within those two main. And you know, it's very fluid. So we're constantly monitoring what the governor, Florida Department of Education, obviously, Dr. Jackson keeps us well up to speed in terms of the health department, and then the CDC, and then our own people are very educated and sending in good feedback as well, and the community as well. So, are there other things that we want to? We're right about 10 o'clock. I think we've had some very good discussion and dialogue. I think what we'll do is we'll go back, watch this, debrief, get our notes, try to send some information out in advance of our next meeting together. I try to begin to look at some options and begin to vet some of those options. We'll have time to compare the different teams so that each team really has a strong amount of data and information to look at next week, because we want to begin to, I mean, we're beginning to formulate ideas and ways to mitigate and some policies and procedures, but we still have many questions to answer.
Mr.
Any
Hill,
additional thoughts?
may I make one suggestion that we consider doing?
Yes, ma'am.
And that is work through some scenarios. Because I find personally that scenario discussions really put some teeth to what we will do. Scenarios could be child becomes sick at school. Another scenario, we find that a child was a close contact of a household member. Teacher or staff becomes sick at school. Some very specific scenarios, and then who does what. So our hair isn't on fire, because we could have a school secretary get a call from a parent. What does he or she do when they get the call? And work through some very specific, what we will have as real life scenarios. And that will make it less scary too if we work through the details.
I think that's a great question, and Shane and Jenny, I think each of us on this committee or subcommittee, if you will, if you will think through some of those scenarios and write some and send them to myself and copy Rob, we will build that out and talk through those and come up with some specific. I think the more each of us think through all the different scenarios that we're going to face, I think that's a great suggestion, Dr. Jackson, and I think that will help us really get down to some of the details of what we're trying to get to in terms of resolutions and practices and those. So if everybody's good with that, if I could see a show of hands, if you like that approach, and if there are other suggestions that go along with that, please weigh in before we conclude our meeting today.
John, I have a recommendation, because we have for the health and safety, we have all different aspects to look at. Getting the kids to school, what happens when they're in school, how we feed them when they're in school, how we get them out of school, and what we do for if sports are going on and extracurricular activities, what do we do for those events? So not to get too complicated, but maybe we could break the sub into a couple smaller subgroups, one to handle transportation, one to handle health and safety in the school, one to handle food, one to handle getting the kids back. That'll be similar to getting them there, but it's a different situation. And the other to handle extracurricular.
Point well taken. Thank you, Steve. It sounded like the first day of school. Get them here, get them fed, get them taken care of, get them acclimated, get them home. we all know, school-based folks, we all know how that rolls that first week, trying to get them there, get them taken care of. I think that will add to the approach. And we can break into smaller groups and then bring information back to this team and then to the whole. That's a good idea. Great idea.
John, I did get a thing from HR where they wanted me to get some people to sit on a committee to help this committee from ASME and PEA to work through some of the negotiation things. HR is working on setting that up. I gave them 4 names for people for mine. I don't know what Stephanie has done with hers, but we will get some information from them. Actually, Laura McCabe's the one that sent me the email to get somebody.
Thank you, Larry. We'll make sure that we get looped in on that. That'll be excellent feedback coming in the team. Yep. Kim, are you good? You're good? Kim Long, you're good?
Hi, everybody. I would like to specifically know how the community volunteers can best support any of these systemized efforts. I think we can marshal awareness and support among certain organizations, and certainly I think all of our municipalities want to help. We just need to find our pathway clear to what it is that we can best support with. You know, I was sitting here thinking about, you know, even if we need volunteer bus stop monitors, and Rob, I don't know what I'm saying when I say that, I'd need more information, but I think we're going to find some willing volunteers, and we already have hundreds at our disposal that are in Jeanette Crowley's system, right? That have already been vetted. Can we redeploy those volunteers in different ways? And will we be allowing those trusted volunteers, understanding they need to continue to be willing, but is there a way to modify the support we've been given? Because I'd hate to lose all of our volunteers, and I think there's a way to probably address that. Is there a subcommittee that I can better serve? Is this obviously this is the team you cast me on, and I appreciate being at the table. I just want to know how to best serve. And of course, our academies, Mr. Cochran's here, our academies run on having business in the classroom.
Correct.
And students off property at the business. It's an experience, not that all school is experiential, all education, you have to experience it, that the model is so dependent on experiential learning. Is there something I can do at this juncture, keeping abreast of the global decisions you guys are making, and then fit some of these pieces together with key leadership at the district?
Right. Thank you, Kim. What I think what I'll do today is I'll debrief with Ms. Townley, and I'm taking notes, and I'll rewatch our video, the video of our recording, and capture these. And I think it's a great idea to select somebody from this team to meet with you, and you have in advance a smaller team or subcommittee, work through different scenarios and dynamics of you know what and how can we utilize and leverage those community members and volunteers that want to help, because it's going to be and it has been, this is unprecedented, and it's something that we're going to all have to work together to accomplish, because it's just if one little slice of the pie and look at it in your own vision and in your own perspective, it's hard to account for everything, and it absolutely can get overwhelming very quickly. So I really appreciate those recommendations. And what we'll do is I'll get some feedback to you in an email as to next steps, and I'll try to do that quickly, hopefully maybe by this afternoon or tomorrow. And then I think it's important, Shane, you have contacts and folks you'll be getting information from, and Jenny, you'll have, each of us will have that. So running some very specific scenarios that you know that you contend with, just like you Shane mentioned the size of the classroom, and not all classrooms are the same. And, one teacher has a bigger, larger classroom because of the design of the school. Another teacher has the same amount of students, but a much smaller classroom. All those little scenarios and dynamics, I think, will really help us, again, to categorize them and then come up with those strategies and practices to try to mitigate them.
Mr. Hill, there's two other things that we really need to put into our forethought as well.
Okay.
One, we need to look at our staff's sick leave policy. If something happens, what are we going to do? Are they going to lose all of their sick leave to be quarantined for 2 weeks? And then they come back, and then there's another exposure, and then they're quarantined for another 2 weeks. So we need to look at what we're going to do as that's concerned. Also,
absolutely.
The other thing we definitely need to look at is what's going to constitute a shutdown. Is it going to be one student that shows up to the school that we're going to shut down the entire school, that we're going to shut down a class? If you're at the high school level, that student becomes mixed with 30 other kids every 45 minutes. So are you going to shut down the entire high school if one kid does? Is it going to be a percentage? How are we going to look at that?
Both excellent points. Thank you, Shane. We've been talking internally, obviously, like as well as you have, with your team and PEA colleagues about the policies, HR. So we'll kick that over and specifically have them look at that. And then that's a great, what does constitute a shutdown, and to the degree, what would that look like and to what degree? So appreciate both of those.
To piggyback off Shane's point about them switching classes, are there going to have to be cleaning protocols in place before students switch to other classes? Even at the elementary level and middle school level, we're departmentalized, some of us. And are we looking at not departmentalizing in the elementary schools to avoid that, or what is going to be put in place? That's another thing that we have to talk about.
Very good. Well, what I'd really appreciate is if y'all make a list of those or list those out and get those to me so that I can compile that, and then we can be sure that we capture that. I've made a note of it, but I want to make sure that and I'll rewatch the video, but when you get off and you're going through your day-to-day, you'll probably have several other things that pop into your mind and you're thinking about in regards to this. So thank you. If any of you need to jump off, I certainly understand. We're about 10 minutes past 10, but are there any other? Those are excellent recommendations and some very specific things we need to think about.
John,
anything else?
Yeah, John, I think we should add somebody from school nutrition to this group.
Okay.
If they're not here.
Rob? We
Like
can
Jenna
put them in
Kessler.
a subcommittee.
Yes, sir. I can get Jenna or
Okay.
Katie.
To be in a subcommittee for us?
Yes, sir.
Okay. And then they can join. All right. Anything else for the good of the group, or any other thoughts or ideas we can work on?
This is Audrey. I have a couple of things just to say. And I was looking at the CDC guidelines earlier, and I don't know how easily this could be done. But part of the issue with having kids go throughout their school is that we would want them to be as close into their cohort as they could be for as long as they could be. So that means in their classroom, and have their extra teachers or additional teachers, their music teacher, those types of things. They would go to the classroom and do their lessons that they have. That's one idea, so that you can keep their cohorts together and limit exposure across levels. Now, that works great in the elementary, not so hot in the middle and high school when you can't really do that.
I see Shane shaking his head.
Like, have two different, so you have to think of different things that will work for different people.
Absolutely.
Another thing we need to address is we talk about kids being positive for COVID. So if a positive COVID kid is on a bus, but we need also to address the kids that are maybe being tested or not tested but are symptomatic, either in the time between they're tested and they receive the results. Because what's going to happen is, a very concerned parent will be alerting all of her friends on Facebook that their child has been tested for COVID, and that is going to run like wild through that school. So those are some considerations we have.
There's a specific.
Right, and I know they're very specific, but that is probably
that
what
is
we're going to face.
Yeah, and that is exactly what happens. And everybody that's school-based understands that many times when something happened on the campus, the parents would notify you by calling and saying they've seen it on Facebook, or they get the information before many times we would. So yeah, that social media piece and then the spread of that is absolutely something to think about. And then the traffic patterns at school, how they're moving around the campuses, cohorts, and those we really need to get. I'll get with a couple of our teachers and principals. Maybe they can get a subgroup and start talking through the different. It looks very different in an elementary school than it does at a middle school, and then at a middle school than a high school. And so very different dynamic with the students. And probably the most active group of all of them, from my experience being both in middle school and high school, is middle school. They are at that age where they're wanting interaction, and so that's a point well taken, Audrey. I appreciate it. Any other thoughts or ideas that we can be working on as we prep and get information to the team in preparation for next week? All right. Well, again, I thank everybody. I thank each of you and this team. Thank you for your expertise and your commitment, and I appreciate your time. You're very valuable. We know this is a heavy lift, and it's very complex and very fluid. And so your expertise and insight is greatly appreciated. And we will, what I'll endeavor to do is debrief and then send an email, get some update, and then work toward putting together those scenarios, breaking them into categories, and then work toward possibly even breaking up some of our team members to work on it and then bring it back to the group next Wednesday. Does that sound?
Sounds great to me.
Okay. All right. Did you have something, Kim? Are you good? Oh, okay. I saw your hand. All right. I want to thank everyone. I want to make sure I did have one from a parent. As a parent, that is what I worry about the most, changing classes at high school, limiting the number of contacts. So that's really that's a very legitimate concern. And so one we're going to have to continue to work on. I think I've got most of those. So we got to work on the testing an employee, the return to work protocols, making sure. And I know, Audrey, we've spent a lot of time trying to work through those protocols and making sure we have a reporting tree, making sure it's tightly aligned to Dr. Jackson's team at the health department. And so I'll go through this chat as well to make sure we've captured everybody's input. So with that said, we're about 15 minutes over. Thank you for your extra time. And I look forward to seeing y'all again next week, and we'll be in touch in the meantime. And feel free to shoot me an email or call me if you have something specific that you want to talk about. I'll be available to you. And just leave a message with Bet, and I'll get back to you. Or send me an email and I'll get back to you. All right. Thank you.